Hey guys, this is Dr. Samir Islam, and in today's video we will talk about how to fix gastritis naturally. For those of you guys who are joining me for the first time, I am Dr. Samir Islam. I am a board-certified gastroenterologist practicing currently in Lubbock, Texas, and my passion is to give you information that's accurate, legitimate, and actually based on facts. If you like this video, I'd encourage you to subscribe to my YouTube page where I discuss a lot of different videos. Also, you can subscribe to my Facebook page where I do a Facebook Live every Tuesday at 7:30 p.m. and you can listen to the replay either on my YouTube page, Instagram, or my Facebook page as well. But in tonight's video, we're going to go over a couple main things. Number one, what the heck is gastritis? Are you wondering what gastritis is, or have you seen this diagnosis in your forms? You're wondering exactly what this is. Well, you'll learn tonight what gastritis is. Number two is that you'll learn what are the causes for gastritis. If you have this, what could be the cause for it, and what can you do to prevent this? You'll also learn what are the symptoms of gastritis. If you're wondering if you may have this, you'll learn tonight what some of those symptoms may be. You'll also learn how do we diagnose gastritis, how can we tell if you have gastritis or not, or what do we look for to give us the signs of somebody having gastritis. Then lastly, we'll talk about how to treat gastritis, both medically and naturally and lifestyle. I can give you a plan to hopefully help out with your gastritis symptoms. But to begin, let's talk about what the heck is gastritis. So when people hear this term gastritis, they have all sorts of ideas in their head of what they could be. They're wondering if there's an ulcer in their stomach, could it be heartburn, indigestion, inflammation? What exactly is gastritis? So gastritis is defined as actually inflammation of the stomach. That itis at the very end usually means inflammation. So gastritis, diverticulitis is inflammation of diverticuli. Colitis is inflammation of the colon, and so gastritis is inflammation of the stomach. It's some sort of response to an injury in the stomach, and there are a lot of different reasons why people can have an injury to the stomach, which we'll talk about in tonight's video. But what it is not cancer, it is not an ulcer. So if you're diagnosed with gastritis, you do not have an ulcer, you do not have cancer. Those are very specific signs and symptoms that we can see or diagnose in patients who have those particular conditions. So don't be scared if you have gastritis. It is not cancer, it is not an ulcer, but it is something different. It is an inflammatory response in the gut for any number of different reasons. Now, what are those reasons could be? There could be an infection called H. pylori, which is a very common bacterial infection in the gut that can cause inflammation, ulcers, cancer, and gastritis as well. There's also a condition called autoimmune gastritis in which your body actually attacks its own cells to cause inflammation to occur. We can sometimes assess this with some of the testing that we do. Very common medications that we take can cause inflammation or gastritis. Aspirin or non-steroidal anti-inflammatories like Aleve, naproxen, Advil, Motrin. This can cause inflammation in the stomach, and that inflammation will cause a response of your stomach to form gastritis as well. And a very common reason for gastritis is alcohol. Simple alcohol, drinking alcohol, can really mess up the stomach and cause it to have a lot of inflammation. And so alcohol alone can also be a cause for gastritis. It can be any number of different things, or it could be any combination of these things can lead to gastritis. Now, the symptoms of gastritis can depend on, honestly, how long you've had gastritis and how acute you've had the symptoms as well. I've had patients who've had gastritis for just a short amount of time and they can feel some pain. Or I've had patients who've had gastritis for a long time because they may be taking non-steroidal anti-inflammatory medications, which can cause gastritis to occur, which can lead to long-standing symptoms as well. But some people, if they have acute gastritis, they can have symptoms of pain or gnawing sensation in their abdomen, nausea, and or vomiting as well. That can be a very common cause of an acute gastritis. Or you can have chronic gastritis, which you can have long, dull pain, maybe even a loss of appetite as well. You can get full very quickly or have what's called early satiety. Or for some people who have chronic gastritis, they may not have any symptoms whatsoever, and that's perfectly fine. If you don't have symptoms from gastritis, we typically don't even worry about it. And so you may have chronic gastritis, but be completely asymptomatic or not have any symptoms from that. Now, the way we diagnose gastritis, the best way for us to know if you have gastritis and the best way for us to see the cause for gastritis is to do what's called an upper endoscopy or an EGD, where we actually go down inside the stomach while you're asleep to see, number one, the extent of the gastritis. Is it covering the whole stomach or not? Number 2, the severity of the gastritis. Is it very severe? Is it acute? Is it chronic? And also, more importantly, we can take biopsies to find out exactly why. We can see if you have that H. pylori infection in the stomach to cause the gastritis. We can see if you have an autoimmune condition to cause the gastritis, or we can see if there's any other reason for gastritis, whether it's alcohol, medications, maybe even bile in the stomach from getting your gallbladder removed. And so the upper endoscopy is probably the gold standard, the best way for us to know A, if you have gastritis or not, B, the extent, and C, the cause as well. So now that you have this diagnosis of gastritis, how do you treat this? What do you do? Well, obviously it depends on the cause and symptoms. What typically we will do is that we'll have some sort of mechanism to help reduce the stomach acid in the stomach, whether it's dietary changes, whether it's putting you on a medication like a Nexium, Prilosec, or some sort of acid blocker. That can help heal the inflammation that's going on in the stomach. If it's due to a specific cause, let's say H. pylori for infection, that bacterial infection in the stomach, we'll give you a treatment of antibiotics to get rid of the H. pylori, which in turn should get rid of the gastritis. If it's due to aspirin, anti-inflammatory medications, we'll have you stop those medications and maybe in addition take an acid-reducing medication to help heal the stomach, and that should hopefully cure your gastritis. If it's due to alcohol, well, obviously the cure for that is to stop alcohol. I'm sorry, but that's really what you got to do. If you have alcohol-induced gastritis, there really is no other way to treat that. Or if you may have another reason why you may have gastritis, we may add other medications to help out with the regimen to get things taken care of as well. But one of the biggest questions people ask me is, what dietary things can I do to fix my gastritis? What are some natural things that I can do to help out with my gut if I have symptoms of gastritis, I don't want to take a medication, or I want to change some of the lifestyle things that we can do? And what I'll tell you is that number 1, minimizing smoked type foods will make your gastritis better. So things that are charcoaled, things that are made with on a grill, things that are smoked type foods tend to cause inflammation in the stomach, leading to a lot of different conditions, gastritis, potentially stomach cancer, and even colon cancer as well. So minimizing those smoked foods will help out with the gastritis symptoms that you may be having. Number 2 is minimizing alcohol, like I mentioned before. So if you can't get rid of alcohol, at least try to minimize the amount so that it doesn't irritate your stomach and cause issues to occur. Number 3 is minimize processed foods. Processed foods are not good for you no matter what. There's so many problems with processed foods, whether it's how it's made, the content, the actual way it's packaged. It is not a good thing to have, and so try to minimize or even eliminate processed foods, deli meat, things like that. Number 4, dealing with stress. Stress is a very common cause for gastritis. It really is. There is a connection between the brain and the gut, and the more that your brain is affected, the more stress that you have, the worse it can cause the inflammation in your gut to occur. And so if you can minimize the stress that you have, that will certainly help out with your gastritis symptoms. Stopping smoking. Smoking is a very common irritant of the stomach, and it can really cause a lot of damage, not only in your stomach, but in your lungs, in your GI tract, and your heart. There is nothing good with smoking, and not only can smoking make your stomach issues worse, it can make your gastritis a lot worse as well. And so if you smoke, in addition to maybe drinking alcohol, it's almost like a double whammy into your stomach and to make your symptoms a lot worse as well. And maybe if you want to eat a lighter meal, this will help out. Try to eat a lighter meal. Try to space out your meals throughout the day. Try to minimize late night meals as well to help out with some of the gastritis symptoms that you may be having. These are some of the simple things that I recommend to my patients who are wondering about what they can do about their gastritis in terms of lifestyle options they can do to make their symptoms better. So in summary, gastritis is defined as actually inflammation of the stomach wall due to some sort of injury that's occurring. There are a lot of different reasons why people may have gastritis, including infections, medications, alcohol, or even other conditions. The diagnosis, the best way we can diagnose somebody with gastritis is to do an upper endoscopy to determine the extent, the cause, and the type of gastritis that you have. And the treatment will depend on the symptoms and the causes that you may have. If you have gastritis and you have symptoms from it, try to eliminate alcohol, minimize processed foods, try to give up smoked foods, try to change the way you eat to hopefully help out with some of the lifestyle things that you can do to help out with your gastritis. So my question today for you is, number 1, I want to know what diet changes you're going to implement today to help out with gastritis. Are you going to try to minimize your food? Are you going to try to change your food? Are you going to try to have a lighter meal? Are you going to give up alcohol or smoking? If you suffer from gastritis, tell me today what you're going to do to take that first step in getting you feeling better and help out with your gut issues as well. I want to thank you guys for joining me today. Every 7:30 p.m. I do a Facebook Live about various different topics. If there's a topic that you want me to speak about, please comment down below. I read every single comment and I want to know what you guys want to hear about. and I will most likely put that topic forward in my next Facebook Live. I want to thank you for joining me today. I look forward to seeing you guys next week. If you enjoyed these videos, I would encourage you to like my Facebook page, follow me on Instagram or on YouTube, where I'll post a replay of these videos as well. And if you have any other questions I can answer for you, feel free to let me know. I'd love to see what I can do to help out with some of your symptoms you may be having, whether it's gastritis or anything else within your gut. Hope you guys have a great day. Thanks and take care.